Breast cancer, as defined by Mayo Clinic, is cancer that forms in the cells of the breasts. But what are the signs and symptoms of breast cancer? How many types are there? How is it diagnosed? We attempt to answer these and many other questions you may have about breast cancer using this short PSA. So what are the warning signs and symptoms of breast cancer? The most notable sign or symptom of breast cancer is a foreign lump or mass in the tissue of the breast, which feels noticeably different from the tissue around it. It is more likely to be attributed to breast cancer if it is painless, hard, and contains irregular edges, but breast cancer can be soft or tender and be rounded. Any swelling or change in the shape of the breast of any kind is another sign of breast cancer, along with irritation and pain of breast skin, nipple retraction, redness, scaliness, or thickening of the nipple or breast skin.
Breast cancer may also spread to the underarm lymph nodes and cause a tumor before a mass or lump is recorded in the breast itself, so any abnormalities in the chest area should be immediately noted by your healthcare provider. According to the Canadian Cancer Society, late-stage symptoms include bone pain, weight loss, nausea, loss of appetite, jaundice, shortness of breath, cough, headache, double vision, and muscle weakness. Eventually, without proper treatment, breast cancer is fatal.
How many types of breast cancer are there? Major types or stages of breast cancer include ductal carcinoma in situ, a non-invasive cancer where abnormal cells are found in the lining of the milk duct. Invasive ductal carcinoma, a common and invasive cancer where abnormal cancer cells begin spreading throughout the body. Lobular carcinoma in situ, a non-invasive cancer that occurs where abnormal cells are found in the lobules of the breast and do not spread. Invasive lobular cancer, an invasive cancer that begins in the lobules of the breast and spread to the surrounding tissue, including the blood and lymph nodes. Triple-negative breast cancer, an invasive cancer that is not receptive to hormone-based treatment programs due to its lack of estrogen, progesterone, and HER2 within. Inflammatory breast cancer, a fast-growing invasive cancer where cancer cells attack the skin and lymph vessels of the breast. Metastatic breast cancer, also known as stage 4 cancer, where the cancer has spread to other parts of the body such as the liver, lungs, and brain. It's also possible to get cancer while pregnant, which can be incredibly traumatic for the mother, even though the cancer is not caused by the pregnancy itself. Breast cancer is the most common form of cancer in women who are pregnant or have recently given birth. It occurs once every 3,000 pregnancies. An estimated 30% or more of all breast cancer in young women is diagnosed in the first few years after a woman has had a baby. Invasive breast cancer spread throughout the body, attacking other structures and tissues and leading to great harm to the patient. They may also cause a remission of the cancer. Non-invasive or benign cancers stay within one location. This refers to the cancers in situ, which are much easier to treat and remove without remission.
What are the risk factors or causes associated with breast cancer? Gender is a possible risk factor, as breast cancer occurs nearly 100 times more in women than in men. Age also plays a part, as 2 out of 3 women with invasive form of breast cancer are only diagnosed after the age of 55. Obesity is a factor in both men and women, and sedentary lifestyles accompanied by poor diets have been associated with high risk for breast cancer. Consumption of alcohol also leads to breast cancer, as well as having radiation applied to the chest area or combined hormone replacement. Early menstruation before the age of 12, late menopause after 55, having children at an older age, or not having given birth may also increase the chance of developing breast cancer. Being in the presence of ionizing radiation as well as plastics containing a high amount of steroids such as estrogen and progesterone are also correlated to a higher risk of developing breast cancer.
A family history of breast cancer puts you at risk for developing breast cancer in the future, as it increases the chances of you carrying the gene mutation that leads to it. A mutation in the BRCA1 or BRCA2 gene, which is found through a genetic test, leads to a high susceptibility of developing breast cancer. The BRCA1 and BRCA2 genes are both known as tumor suppressors, as they are specially made to prevent cells from growing and dividing uncontrollably. Naturally, a mutation in either gene prevents them from being able to successfully express phenotypically, resulting in a higher risk of abnormal cells and development in the breast. Mutations or doubles of other genes, such as ATM, which helps repair damaged DNA, PALB2, which interacts with the protein made by BRCA2, PTEN, which helps regulate cell growth, and a plethora of others also greatly increase the likelihood of developing breast cancer. Receiving breast cancer in one breast may also lead to development of breast cancer in the other breast as well. What are some methods of diagnosing and treating breast cancer? According to the CDC, breast cancer is diagnosed in one of four main ways. Number 1. Breast ultrasound. Using sound waves, doctors create pictures, called sonograms, of the inner structures of the breast and its tissues. Number 2. Mammograms. A specialized and detailed X-ray of the breast that covers most of its inner structures. Number 3. Biopsy. Doctors remove or excision parts of the breast tissue or fluid for examination under a microscope and through testing. Number 4. MRI. Using an electromagnetic computer imaging system, doctors will take detailed pictures of areas inside the breast. Additionally, according to the CDC, breast cancer is clinically treated in one of 5 ways. Number 1. Surgery. In this method, surgeons can perform an operation known as a lumpectomy, a type of mammary excision that targets specifically the abnormal cells and removes them completely from the body in an attempt to prevent the spread and possible remission of the cancer. Surgeons may also perform a mastectomy, or complete removal of the breast tissue and mammary glands in the case that the tumor is too large to excision from the rest of the breast tissue. Number 2. Chemotherapy. In this method, doctors treat the cancer by administering drugs to the patient using pills or an IV drip. Adjuvant chemo drugs are used to treat any cancer left behind by other treatment methods. Neoadjuvant chemo drugs are used to treat cancers that are too big to be removed via surgery and are used to try and reduce the size of the tumor. Number 3. Hormonal therapy, where the cancer is restricted from the hormones it needs to grow. In this therapy, doctors curtail the production of estrogen, progesterone, and HER2 in the body, preventing the growth of the tumors. Number 4. Biological therapy, where doctors work with the body's immune system to aid in dealing with the cancer or to recover from side effects caused by other forms of treatment, such as chemotherapy or surgery. Number 5. Radiation therapy, where oncologists utilize powerful and localized X-rays to kill the cancer cells along with some healthy human cells as well. This is only used in cases where tumors are dense and localized.
The following are some notable statistics regarding breast cancer. Each year, approximately 70,000 men and women aged 15 to 39 are diagnosed with breast cancer. Every year, more than 1,000 women under the age of 40 die from breast cancer. More and more evidence tells us that breast cancer before the age of 40 differs biologically from the cancer faced by older women. The incidence of metastastic breast cancer at the time of initial diagnosis is apparently rising in women under the age of 40. Only 1 in 1,000 men will ever be diagnosed with breast cancer. Men carry a higher mortality than women do, because men are less aware and are less likely to assume a lump is breast cancer, so they delay in seeking treatment. The majority of men diagnosed are over the age of 50.
Additional information can be found in the slides that accompany this PSA. Thank you for watching, and we hope that you learned something new about breast cancer today.